All right, so we're gonna have the sponsorship spotlight. The Abbott team member will be Kellyanne Chin, so she'll come up and speak to you briefly, and we should move on from there, right? Okay.
All right, guys, hello again. All right, I'm going to be brief. A lot of this you should know already, okay? But keep it in mind. All right, basically, as you know, our program, our products, they all deal with these particular disease conditions. And of course, just going through quickly, your Cari-Med. Now, before everybody kill me about it, yes, we have a new Cari-Med presentation, okay? But just to remind you, it's a broad spectrum macrolide. It's the only one that actually has an active ingredient, metabolite. So it actually, which is produced by the liver. So we won't have a petri dish for testing, in vitro testing, right? So you'll have an underestimation of the activity, in vivo activity. So again, it's used against a wide variety of bacteria, challenging respiratory infections, okay? And of course, it's bactericidal concentrations in terms of with the macrolide, okay? Again, you use it for upper respiratory tract infections, lower respiratory tract infections, soft skin and soft tissue infections, and also for the eradication of H. pylori. And of course, as you can see, achieves both intracellular, extracellular. It's an immunomodulator, one of my favorite words. And of course, you get rapid symptom relief after 48 hours. It doesn't have an effect on the healthful flora of the stomach, but that does not mean you don't keep eating yogurt. That will also help. And of course, it has less gastrointestinal upset with the XL, which is a once a day, right? You don't need, please stress it to your patients, do not refrigerate the suspension. And of course, it has a fruit punch flavor. Now, benefits to your patient, it's gastric stable, so again, food has no effect, and of course, you have the formulations. Now, as you know, what we have, there's a change in some of the formulations, presentations. The 500 immediate release, which is a BID, which is your H. pylori, it's still in existence, but the XL, Cari-Med XL, is going to move from a box of 7 tablets to 10 tablets, okay? The pediatric suspension, the 125 in 5 ml, the 250 in 5 ml, will now be a 60 ml bottle. And the reason for this is because we no longer have our London, we used to get our 70 and 100 ml from our London plant, which we no longer have, that has been sold to another company. So we now have to get our presentations from Latin America, and they only use 60 ml bottles. I know some of you already have it in the pharmacies, and you can see there's a new presentation, right? This is also because we actually acquired another company in Latin America, one of the largest pharmaceutical companies in Latin America, called CFR, and therefore everything has been, what's the word again? Compiled together as one. We're now one. So everything you see is basically coming from the Latin American plant now. Okay. Right, our gastro, right, in terms of, by the way, in terms of the suspension, the price will still be the same per mil, right? Right, but, so right, I know, but in other words, the price won't be higher than before. Actually, there is going to be a little change in the dosing. It's actually going to be 6 to 14 days. Okay? You're still going to have to buy 2 bottles, I know, but I don't think it will go to waste. No. All right. When choosing a pump, of course, remember you're a gastro. Definitely getting good stuff to eat this evening, so I know nobody will have GERD today. And of course, as you know, the benefits of it. And I will still say originally still simply the best, because you get these lovely wide approved indications and the unique changes and benefits. If you need a new dosage card, please over at the desk if you need it. And of course, remember, it's still the 15, Orgastra 15, is really both for maintenance, but actually there's an increased use, particularly among the pediatricians, for the use with GERD with Orgastra 15. And we usually do recommend that they do buy Orgastra 15 for the patient, right? Tested, true, tried and tested. right? Again, with the Synthroid. Again, I thank all of you, and I'm going to make it even better. We listened. I know you all don't like the 100 tablet bottles. So, coming soon, you'll get a new presentation, which will be boxes of 30 tablets in blister pack. Can I get an applause for that? We work hard for these things, you know. Hello. So, I would like that I don't have that excuse anymore. We're not going to stock it because we don't want to open the bottle. I can get a commitment from everybody here that you can at least stock 1 or 2 of the most common strengths. All right, I'm holding you to it. Oh, and these, oops, all right. Basically, we used to have about 10 presentations available, but right now those are the ones that will be available, the 25, 50, 75, 88, 100, 112, 125, and 150, okay? Anything else you can mix and match. Right, the dosing guidelines are over there if you need them. Just remind you, we have our blow press, Candesart and Selexatil, both in terms of the plus for the more severe patients, and of course the plain 8 and 60 milligram strength, and the combination. And of course, okay, this is one I get into a little bit more. Where you have the Depakote and the Depakote ER, which is divalproic sodium. And basically it's a combination of the two, as I said before, valproic acid and valproate sodium together to give you the divalproic sodium in a 1-to-1 combination. Right? It is used basically for your mania, in bipolar patients, for seizures, epilepsy, if I should say, and prophylaxis for migraine, right? Now, just to remind you about the bioequivalence, because I know I still get calls about this, you have 2 formulations. Bioequivalence basically talks about 2 formulations of the same drug, same dosage, equal strength, contain the same active ingredient, right? If the bioavailability are alike. The problem is Depakote and Depakote ER are not bioequivalent, okay? The Depakote, just to remind you, is a BID, where the ER is once a day. And the average bioavailability of the Depakote ER is 89% relative to the Depakote. And therefore, you have to use doses that are 8 to 20% higher. Easiest thing to remember, as I said to you before, your total daily dose of the BID, if it's 2,000 or less, you add 250 to get the equivalent dose of the ER. If it's more than 2,000, then you add 500. If it's still, you still have dosage cards over there that you can utilize. The Depakote BID now comes as 30 tablet bottles, okay? The ER still remains as a 100 ml bottle, okay? So, and of course, your contraindication, that's all over there in terms of the safety profile for the product. Just to remember, both of them are available in 250 and 500 tablets for easy initiation. And of course, the ER is indicated for adults and children 10 years and older, okay? And they should take it whole, right? Yes, we still have hydrate, right? The starter packs, you don't have to. We usually supply the starter packs to our doctors, right? But usually 2, 5, and 10 milligrams are still available. And we do have, for those cardiologists who prefer, their patients prefer the Isoptin S240 SR, we still have that available as well, okay? So, just to remind you which ones are available on NHF, and I know the Clarity suspension NDC number is still pending, so please feel free to call Cari-Med for it, because they're the ones who have to generate it for you, to give it to you, okay? And of course, remember your reps. Thank you very much.